Welcome everybody. And I'm going to just start with a few important housekeeping things just to answer some common questions that occur during these trainings or webinars. This is for natural treatments for osteoarthritis. Tonight, I am the speaker, and my name is Thalia Charney, and I'm very happy to have you here. And I have a co-host who is Corey. She's behind the scenes. You can't see her, but she's going to be watching the chat and helping to answer any questions other than technical questions about the products for you. But the main things you need to know is firstly, now, of course, you can chat with one another and share things in the chat and go ahead and do that. That's what the chat is for. But if you have questions for me, I will get to them at the end. I will take 15 minutes of questions. Please put those questions in where it says Q&A, which is a different area on the bottom of your screen. That's where I'm going to go to the Q&A. Try to be concise and keep to the topic. I'll answer as many as I can, and I'll certainly start with those that are sort of on point to the topic. Secondly, I often get asked, will there be notes? You actually will be able to watch the presentation again as many times as you want. It's always placed on the Healthy Planet YouTube channel. They take a few days to put it up there, so just check back if you don't see it. And another question we often get is about products, where to find them. You can go to nowfoods.ca, but no, won't get to that for a while. And that's it. Okay. So I'm going to get going. So by way of a little bit of an introduction, you might recognize me if you've been attending these regularly. This is probably my 10th, 11th, 12th, I don't know, lost track, but of doing webinars for Healthy Planet. So I'm happy to be back. And my name is Thalia Charney. I'm the Nutrition and Health Education Manager for Now Foods Canada. I'm a holistic nutrition and wellness coach. I've had many different roles in health going back 35 years now, being a personal trainer and a fitness instructor and studied many different things. So kind of very broad-based knowledge. These are my training values, which I'd just like to put out there. And I'm also an author of 3 books. I do love writing, but none of which are on the topic for tonight. And of course, I have to give this disclaimer, so forgive me, I know disclaimers are boring, but important just so that we, of course, know that everything that I say tonight or on the slides or questions answered at the end, this is all for informational purposes only. I'm not practicing medicine here. And so everything that you take today is at your own risk. Of course, hopefully you have a healthcare provider or more, and this is a great place to learn things, get your mind going, consider other options to help you with various issues or friends or family, and then take those to somebody that you trust who knows your health well. You can visit nowfoods.ca, as I said here, if you forget or want a refresher on suggested uses, doses, or cautions for any products. There you'll find all the information on how you can use it and when you shouldn't use it and that sort of stuff. And a quick introduction to my extended Now family. This is the Now family. Now is who is sponsoring or co-sponsoring this, is a now 56-year-old family-owned company. You can find them in Guelph, Ontario, in part, where most of the Canadian products are produced. And there's a great story. If you like reading at nowfoods.ca, you can read about this very fascinating story of the founder, Elwood Richard, and his family, and what they've done for a few generations now. This is Elwood Richard. He was a scientist, and we're well known for many things, but mostly for our quality testing. We have 8 state-of-the-art labs. We qualify as a third-party lab, but we do our own batch testing, 19,000 quality tests every month. Okay, so let's jump into the topic for tonight. Osteoarthritis, of course. Okay, so just one quite a stunning fact, notable fact, osteoarthritis is the leading cause of disability, at least like I would say in North America. So And a lot of the studies, I have to say, that I find when it comes to supplements focus on the knees. So you can take that into consideration. Now, of course, first you have to establish the fact that you have, we often just call it arthritis or osteoarthritis. Make sure, that anybody, if you have pain in your knees or issues, that you have a practitioner rule out other things like rheumatoid arthritis or gout. This is just about straightforward osteoarthritis. And osteoarthritis is something that can occur not only in the knees, but it's pretty prominent in the knees, and it has various stages from, just the beginning to more severe. And there's two things that are really happening. We have this, where the knee joint is here, we have this covering, which is the articular cartilage, it's called. And, if not for that cartilage and the kind of fluid between it, which is called the joint cavity, and it has a kind of a liquidy state there, much like if you crack open an egg, the egg whites, it kind of is like that. It's called the synovial fluid. Between the two of those, they prevent the joints from actually rubbing against one another. But once you get to the severe stage, that's what happens. It can be painful. You can get stiffness, decreased mobility, and it can be very unpleasant. And people are, of course, seeking solutions. Why do we get osteoarthritis? There's many reasons. As we age, unfortunately, everything starts to slowly break down, as we know. So as part of the aging process, we, for whether it's our joints or our bones, we're making more of that stuff in our joints and we're breaking it down. Those two are always going on, creating new stuff, breaking it down to keep it fresh and healthy. But as we age, whether it's the bones or the joints, less of the old not so great stuff is removed and less of the stuff is produced. And so we just get a situation where things are not as healthy as they were when we were young. Trauma, of course. Obesity is a significant factor in osteoarthritis. And that's for a couple of reasons, but one of them is simply, as it says down here, every pound of weight adds 2 to 4 pounds of extra pressure on the joint. So it's simple mechanics. But also things like diabetes, family history, which the family history could be based on, as it says here, joint shape. I have my lovely brother-in-law. He has a sort of bow-legged here, runs in his family, and they all have knee problems. So depending on kind of how the structure of your body is, you can be more prone to getting osteoarthritis, even when you're doing everything to take care of yourself. It's just the luck of the draw. And other things going on as well. So it's multifactorial, of course. I thought this was a great quote from the podcast, The Drive, by Dr. Adam Cohen. He's an orthopedic surgeon. And he said, being very honest, our toolbox of things to use when someone comes in with knee arthritis or hip arthritis are pretty pathetic. And I think that's an honest statement, and I appreciate that. And because of that, this is not to say that you can't or shouldn't use mainstream medicine at all, but you can always have additional help and, combine things or whatever works for you. Now, these are common treatments for osteoarthritis that I've listed here. Some of these are drugs over the counter, like NSAIDs, which would be like Advil. COX-2 inhibitors can be prescribed, but they do have side effects, such as increased risk of stroke and other heart issues. So doctors are not so happy to prescribe them as they once were. And we've got Tylenol. Sometimes by using natural things, we can reduce those doses. We can, do away with them altogether. It depends. Some people need surgery, depends on the stage. Weight loss is definitely helpful just by, again, because of the impact as I described before. But in this 2019 meta-analysis, the number one evidence for best, for the best help you can provide for osteoarthritis was exercise. I don't think they included in that meta-analysis looking at supplements and such, but I would agree with that. I mean, exercise of different kinds. So sometimes it's weight training, definitely stabilizing the joints and strengthening and helping with our structure. And this can be done with a personal trainer Physiotherapists can be amazing at helping out with pain and alignment and other things like that. I've read about, just even sometimes simple things like going up and down on your heels or doing squats, but getting the blood flowing to the area. The cartilage in the area, unfortunately, it's not very vascular, so it's hard to get nutrients to it, but mobility is always important, and we are a very sedentary sort of population by and large. Now, symptoms of arthritis, of course, don't expect you to look at this and diagnose yourself because they can be overlapping symptoms with different issues, but pain is the one that usually drives people into the doctor's office or the health food store to get help. But there are other symptoms like popping and grinding and swelling and mild. There shouldn't be a lot of swelling in osteoarthritis, so you might be dealing with something else in the knee, an infection or decreased range of motion, muscle weakness. So there's all kinds of symptoms, but pain is definitely the one that can be the most debilitating. There's not a lot of evidence for osteoarthritis in diet, although if you go see, maybe a nutritionist or a naturopath, they surely may try many things that there's not necessarily strong evidence for, but could be helpful. So I don't discourage you from doing that. But in terms of the strongest evidence for diet and osteoarthritis, the strongest evidence out there is that, that's not helpful is caloric excess. If we're eating too many calories, which of course can lead to obesity, that's the strongest contributor. Now, it's not only because of the loading on the joint, the weight, it's also because obesity or the adiposity, the fat tissue is not inert. It actually produces inflammatory compounds, and so that can contribute. We used to think that ordinary osteoarthritis didn't have any inflammation associated with it, but we now know that there is low-grade inflammation in the synovial fluid area, so it does exist. It's just not like rheumatoid arthritis, where that's a major factor. And there's weaker evidence for things like eating more fatty fish, which contain omega-3 fatty acids, or getting a better balance of omega-3 fats versus eating too many omega-6 fats. I'm not one who says omega-6 are not bad. Oils that come from seeds and nuts are not bad. It's just all about balance, and it's hard to know with the evidence exactly what that perfect balance is, but we definitely need omega-3s in our diet. And vitamin K was another one mentioned, that there's weaker evidence, but some. Vitamin K, if you've done any webinars on osteoporosis, they always talk about it as helping to mineralize the bones, to drive the minerals to the bones, kind of direct them. And the same may occur with the joints as well. So being generally healthy always helps the joints and elsewhere. Now, this is a bit of a more technical slide, but I really encourage you to pay attention to this one because I'll be repeating so much of this throughout, and this one will help you. You can even take out your phone if you have it near you and take a picture of this and look at it as we go through. But this is a very cartoon version, a very inaccurate, but just simplified version of what do we find in that cartilage, in the articular cartilage. And the reason it's interesting to know the different things we find there is because these will parallel with many of the supplements that I'll show you. So in your cartilage, you will find collagen for sure. And collagen, if you think of it as this is as a tall steel structure, collagen helps provide structure and strength. Just like steel, it's very strong and it can bend without breaking, but it doesn't stretch. So it's that kind of strength like steel. Very helpful all over the body. Hyaluronic acid is something also found in the articular cartilage and in the synovial fluid. Its claim to fame is that it attracts 1,000 times its weight in water. We need water in the joints. All of this stuff, by the way, exists in and outside of our cells. We got cells in the joints, but outside of that is this big area called the extracellular, outside the cell, extracellular matrix. And that's where we find most of these. So the hyaluronic acid is important. That too can be, there are supplements, but I'm not covering that tonight because I've got so many other things to go through, but that definitely is something to keep in mind. Basically, you'll find water in the joints. Chondroitin sulfate is a common supplement, often combined with glucosamine sulfate. So chondroitin sulfate you will actually find in the cartilage itself. And it is described as something that helps dissipate impact. Kind of think of it like an airbag in a car. It helps dissipate, like kind of spread the impact out. So it's not all in one area. I like to think of it or as like maybe as a spring, like you see here. And then glucosamine sulfate, you may have heard of as well, often combined with chondroitin sulfate in supplements, sometimes not. And it doesn't actually exist in the cartilage, but is thought to play a role in helping with creating some of these, maybe as a building block, and other roles I'll get to. So just keep those in mind. We've got a hyaluronic acid to help us hold on water, chondroitin sulfate to dissipate the impact, collagen for strength and structure. Now, why did I underline the sulfate on both of these? Because I'm going to get to, there's a whole bunch of supplements that contain sulfur or sulfate as it's written here. And it is thought to also help attract water. Water is an important part of keeping our joints mobile. So that brings me to sulfur and sulfur-based products is the first part here. This is a way you can think of sulfur. Sulfur is thought to attract water because it's negatively charged, and water is polar. It has a positive side, and so it will attract the part of the water that is positively charged, kind of like the magnets of the positive and the negative sides. So osteoarthritis is characterized in part by this altered sulfation of the cartilage. So it is thought that maybe there's something going on with sulfur and it not being present or properly presented in the best way to help function as it is. Now, this is sulfur. Sulfur is naturally occurring in the earth and in our bodies. So sulfur-containing compounds for the joints that you'll find in a health food store are everywhere. You got glucosamine sulfate, chondroitin sulfate. Now, glucosamine sometimes comes in another form. I'm going to get to that and compare the two. MSM, which if you sound it out is methyl sulfonylmethane, also contains sulfur. And SAMe is probably one you may be less familiar with for the joints, but it's a very interesting supplement. Also contains sulfur. Now, we can get sulfur in the diet. I've listed some foods here, but it is lower in those eating for a vegan or vegetarian diet, but it is something that is naturally occurring in the diet. So I'm going to start with SAMe because it's less familiar, and I think it's really interesting. On the bottle, it says helps reduce pain associated with osteoarthritis. This supplement has the best evidence of all the ones that I'm covering tonight. Now, that means a lot in terms of like the strongest effect. That may have to do with it being well studied, but I think that it just has a stronger effect. One thing I want to point out is you can see that this one says stabilized and that one says enteric-coated. The reason the Now brand has these particular forms is that SAMe is a very unstable compound, and if it's not specially formulated, either enteric-coated or we created a method to stabilize it, it breaks down and then it's of no use to us. So so that's an important thing when you're looking for SAMe, just to get a stabilized or enteric-coated form. The only downside to SAMe, other than I will show you there are some contraindications, would be it is more costly than chondroitin or some of the other supplements you'll see. It's definitely a higher price point. So you can see now on this is from our website, I just did a screenshot, but it helps reduce pain associated with osteoarthritis, as I said, but it also says on there supports mood and brain function. So just to avoid confusion, I'm not going into the details, but it does have that dual role. That's why it is very interesting. It's our body's main methylator, if you've heard that term. And don't worry if you haven't. But if you're interested in knowing about its other role, you can go to the Healthy Planet channel. And I've done fairly recently a webinar called Depression Coping with the Inevitable Ups and Downs of Life, where I go through the details of SAMe in that area. but it is prescribed in Europe for osteoarthritis and depression. And there are at least 4 clinical trials of good quality that show notable effects for SAMI. One of these studies, actually, this one that I'm showing, they were using the raw ingredients of the Now brand. And so the conclusion was simply SAMI has a slower onset of action, but is as effective as celecoxib in the management, so just a prescription, the management of symptoms of knee arthritis. So a little bit of a slower onset. That's always helpful to know. You know, maybe take a few weeks before you notice the full effects. Here is another review of SAMI. So it's, the conclusion here, generally speaking, was compared to other drugs that are used, it's safer with fewer side effects. It does take longer to work, so 2 or more weeks. The relief lasts, based on studies, for up to 56 days after discontinuing it. And it's equally effective for pain and mobility as quite a few different drugs or over-the-counter drugs that may be used for osteoarthritis. And sometimes here again, I'm not suggesting people have to discuss with their own practitioners what they're using and not, but it may be a fact of you can replace something, perhaps you can reduce the dose. There's all kinds of possibilities through the trial and error that you may be interested in trying. And 18% of people using 400 milligrams over 2 years were free of symptoms. So I always, like with my clients in the past, I always find multifactorial approach is the best way. Look at the diet, do some exercise, take some supplemental support, use other things as needed. Just as mentioned here that these are not human studies, but in animal studies, SAMI has shown that it can stimulate the production of cartilage. So there is the potential maybe for actually some reversal, though we can't really say that. The studies haven't been done on humans, so we can't say how long, what's the equivalent, and we're not, those animals, but it's certainly intriguing, and hopefully there'll be studies in the future. And just the risk information on the SAMI bottle I wanted to show you. Some of these, like, don't use if you have bipolar disorder, or if you've recently discontinued this drug used for depression, or even it says consult a doctor if you're on any other medications. That all really has to do with the fact that it can have effects on chemicals in the brain. That's why it may be helpful with mood or depression. And so that needs to be taken in consideration, even if you're using it for arthritis. And you may be a person who it could work and be helpful for both of those. So that's something to look into. Okay, so on to glucosamine. So glucosamine is, say, used to make parts of the joint cartilage. This I just like to show what it looks like in its molecular structure because I'm a nerd. But it's extracted for the most part in most supplements from the exoskeleton of crustaceans like crabs and lobsters. Although we do have a form that comes from mushrooms, and that's for the purpose of those who are vegetarian. And it's used for osteoarthritis. That's definitely its most common use. There's some intriguing potential uses we might hear about in the future. How does it work? Don't worry about this complicated pathway name, but I had to name it. But this is how it's thought to work. So we have a pathway in our body, which starts with glucose, which is just plain sugar that we all have. Now, glucose often goes off into another pathway here, which ends up just creating energy in our body, ATP. We use glucose for fuel. But there's a different pathway it can go down here, and that pathway can result in chondroitin sulfate and hyaluronic acid. I told you these would keep coming up, which we can find in our cartilage and joint cavities that again help with retention of water and dissipating impact. But there's a kind of a place in this pathway where there might be a bottleneck where things don't flow very well. And so in a very unscientific way, I'd say glucosamine helps to encourage this particular step bottleneck here. It assists the enzyme that does that. Enzymes do a lot of the work in the body. They speed things up so that they occur more efficiently. So that's how glucosamine is thought to work indirectly rather than, being a component of the joints itself. Evidence for glucosamine. Now I'm looking here at examine.com, which, by the way, is a fantastic website. They're objective, unbiased, don't sell any supplements, and review a lot of natural health products. Very good body of scientists. So if you can ever, it does cost to get all the information, but I subscribe to it and I love it. So having said that, and they only review peer-reviewed clinical trials. They don't look at animal studies or anything else. So they looked at 19 clinical trials and said there's consistent results of high quality studies that glucosamine has a minor effect on pain. Now remember I said SAMe has a notable effect. So SAMe is definitely stronger when it comes to pain. It has a minor effect on pain comparable to acetaminophen, as they say. Its best use may be to preserve joints. So preservation of joints, either keeping them where they are or maybe even partially reversing. There's not strong proof, but there's some. And glucosamine, I think, is often misused, and that's why sometimes people say, oh, it doesn't work. It's not profoundly effective for pain, but it can be helpful, and it varies across people, but it's best thought of for preservation of joints, which is also an important thing. If you have it, a lifestyle where your joints will deteriorate a lot, maybe like an athlete, or you think you might, or it runs in the family, or you just want to preserve your joints. So that's useful in and of itself. Here's a 2005 systemic review. So they looked at 13 randomized controlled trials on glucosamine therapy. And the conclusion was, just to get another opinion other than on examine.com, bottom line is they said it provides evidence that glucosamine is both safe. It's definitely one of the safer supplements, not too much to worry about. There's no such thing as something that never has side effects for anybody. Some people may get digestive upset, but it's pretty safe as far as supplements go, and effective in osteoarthritis. It was superior to placebo in all but one of the trials, and sometimes superior to NSAIDs, which is non-steroidal anti-inflammatory drugs. Now here is glucosamine sulfate. Again, I'm talking about the sulfate form, and a study that showed that it may delay the progression of knee osteoarthritis. So this highlights a 3-year randomized controlled trial, because if you're looking at preservation of joints, you can't do a 2-week study. You got to look over some years. This is a nice chunk of time, 3 years, using 1,500 milligrams a day. That's a fairly standard dose that you'll see on a supplement of glucosamine sort of by itself or even in combination. And it retarded progression in the joint space and had a minor symptom relief as well. Minor symptom relief is okay. You might be using 2 supplements or 3 supplements or, whatever it is to get you where you need to go. So here's an idea for primary prevention of osteoarthritis, where something like glucosamine can be helpful, where you have, here's 2 studies looking at its effect on young athletes. Athletes, just by the nature of their professions, are putting a lot of stress and strain on their joints. So they studied this Japanese team in this case, and they looked at the markers of, there's certain markers you can measure that show how much your cartilage is being made, so synthesized, and how much is being broken down. And both need to take place, again, to take away the old stuff and put new stuff there. But by measuring those, they did notice that after 3 months of treatment with glucosamine, the level of those biomarkers in the athletes had improved, and then after stopping it, they returned to the levels of the control subjects, which were just ordinary people who are not athletes, so obviously not working out to the same extent. Now, I said I'm going to compare the 2 types of glucosamine for you, and we carry them both for different reasons. So there is a glucosamine sulfate, as I've mentioned. That sulfate may itself have a role in why it's helpful for the joints, because it has that sulfur, which attracts water, which is important. But we also have glucosamine hydrochloride. Why? Well, firstly, this one does contain more glucosamine, given the same amount of milligrams of these two. I think that's sort of neither here nor there, but just to note it. But the reason that some people ask for the hydrochloride is it's low in sodium. Glucosamine sulfate, depending on the product, may be up to 30% sodium. There's different ones. So glucosamine sulfate potassium, which we have in our supplements, doesn't have, but you can see glucosamine sulfate sodium chloride out there as well. So if anyone's on a strict low sodium diet, doctor recommended because of hypertension, then they may be choosing this one. But for many of our supplements, the amounts are very small and nothing to panic about, especially if you don't have any restrictions and you don't think you're eating a lot of processed foods high in salt. I'll give you a couple of examples, but we have many supplements, so but the levels are not necessarily very significant, but they're there. So this is a source of sulfur that's important. And another important thing is, most importantly, is most studies are on this form, and there's definitely more evidence. So if I had my pick, I would use glucosamine sulfate unless for some reason I had to restrict salt. So that's my take on this. And again, not all glucosamine sulfate has sodium. It depends if it's the potassium or the sodium form. So you got to read the label. So chondroitin, that's the stuff in our joints that dissipates impact. Not too much in the way of studies of that by itself. It's almost always in studies combined with glucosamine or even other things. So it's a bit harder in the evidence, but we know it's in our joints. This is what it looks like. This is a more, like this is the molecule, but a kind of a representation of how it looks in the joints. So I think it looks like a feather, and this is dissipating the stress that's coming. So I think it's very interesting looking. It is extracted from the trachea of beef. So that would be in the throat area, just for those who are interested. So it's not vegetarian. And how does chondroitin work? This is coming from examine.com. Like this description. So chondroitin is a hydrophilic, means it attracts and draws water into the cells, which helps with hydration and with mechanical support in the joints. It also helps chondrocytes. I didn't mention chondrocytes, but those are the cells in our cartilage that actually produce some of those things in the cartilage. They kind of make the cartilage. And it helps those chondrocytes to regenerate more effectively. It also seems to have anti-inflammatory effects, and it may help with arthritis, but also other diseases of aging. Both glucosamine and chondroitin, you'll hear stuff about they may help with other diseases and aging, and that's because that extracellular matrix I'm describing in the joints isn't only there. I mean, it looks a bit different in different areas, but the extracellular matrix can be found in our arteries, in our heart, and all over the place, in our bladder. So there's certainly other kind of possible uses that need to be explored. So reflections on chondroitin from examine.com may help with pain and joint stiffness and slow down the progression of the disease, much like glucosamine. But they also say chondroitin could be beneficial as an anti-aging supplement used for other degenerative diseases. And there's an association, now it's not cause, so an association has been found between chondroitin use and longevity, as well as between chondroitin use and lower cardiovascular disease risk. Controlled trials are needed. Hopefully we'll have them one day. I wouldn't hold my breath though. Chondroitin may also be used in people with recurrent bladder infections or those with interstitial cystitis. That's a really interesting possible use, for trial and error if you have chronic issues. But again, it's not a claim on the bottle at all. So that's just must be some evidence out there for that, which I haven't explored, just because that wasn't the focus of today. Okay, so on to MSM. That's got that sulfur in it as well. This is what MSM looks like. Here's the sulfur, and it attracts water. So it is naturally occurring. You can find it in our blood, in our cerebral spinal fluid that circulates in the brain. It has an affinity or an attraction for connective tissue. And connective tissues are tissues that support and protect the body, like the joint area that I described. Other areas as well can be connective tissue, our cartilage and our tendons and so on. And it may help increase cross-linking of collagen, thus stabilizing. So I haven't gotten to the collagen supplements, but we know that collagen is important in the joints as well. It's like that steel structure giving strength and stability. This is a Health Canada monograph, which anyone can access online, but they can be a little tricky to find. So it just describes MSM as helping to relieve joint pain associated with osteoarthritis. And it says avoid taking at bedtime. Kind of Googled that. Seems to be some evidence, but it's very iffy that it might be stimulating to take in the evening. It's not that it's dangerous or anything. So if you don't find it stimulating, take it whenever you want. But that's just something that's been noted. So here's a pilot clinical study. They used 3 grams twice a day. The recommendation is to build up to that. Now that 3 grams twice a day is more than the recommended, about double the recommended dose that Health Canada puts on here. So I just want to let you know that, because sometimes these studies are more than what is recommended. But it led to a modest but significant benefits in pain, 25% decrease, and physical function over the placebo. But there's quite a few studies combining MSM with chondroitin sulfate and glucosamine rather than on its own. So here, comparison of glucosamine, chondroitin sulfate with and without MSM, a study. And in this particular study, they found only glucosamine and chondroitin with MSM demonstrated a statistically significant effect on pain and osteoarthritis. Again, remember that glucosamine and chondroitin help with pain in a minor way based on what we can tell so far with studies. Their role in maybe preserving joints may be a more important consideration. So adding something else that can help with the pain, depending on how much you need to manage it, is something to keep in mind. And that's why there's a lot of supplements out there like this one with glucosamine and MSM and chondroitin, often combined together based on a trial like this. And we've matched the doses of this trial. Now, there are many products that now carries, and you can go look on the Healthy Planet on their website and just search and you'll find. So I'm not showing you all of them. I just wanted to show you 3 here that I think would be interesting for many people. One here, because it's an extra strength, glucosamine and chondroitin. You can see it has glucosamine sulfate, but the potassium kind. So there's no sodium, but it does have chondroitin sulfate with some sodium. It's a very small amount of sodium, like far under the RDA. And here's the claim: protects against deterioration of cartilage. So recognize there the deterioration of the cartilage, and helps relieve symptoms of bone and joint pain. Here I put the sodium is 55 milligrams per tablet, and the RDA for sodium is 2,300. So just to give you an idea, taking 2 a day, you're getting maybe around like just over 100 milligrams of your RDA. It's not a lot, but I mean, again, it depends if you're eating tons of salt or on a restricted diet. There's the vegetarian glucosamine and MSM. So this one is made from, it's made from Aspergillus fungus. So this is many B vitamins are made from fungi. So it's not a uncommon way to make supplements produced that way. Helps maintain healthy cartilage. And then we have the liquid glucosamine, chondroitin, and MSM. I wanted to show you that one because some people just prefer liquids to capsules or tablets. And this is flavored. I'm trying to remember, like mango and one other, I can't remember the other flavoring in there. Sodium is 70 milligrams per tablespoon, and you take 2 tablespoons a day. This has the glucosamine, chondroitin, MSM, also vitamin C, beta carotene, put vitamin C twice, manganese, and a few other supportive ingredients. And then generally speaking, when you look at a product like with glucosamine, chondroitin, and MSM, the risk information on the bottle is pretty simple, not overwhelming. It's, do not use in case of pregnancy and breastfeeding. That's kind of across the board with anything unless it's been studied in those, and we don't tend to study things in pregnancy or breastfeeding. So that's why it's just kind of, you usually see that with almost all supplements, with very few exceptions. And consult a healthcare practitioner if you're experiencing GI pain or bowel disturbances, because in some cases with some people, any one of these can cause some digestive upset. And I added something here, not on the bottle, so it's not of concern to Health Canada. So I'm just really being extra cautious, but this is of the another opinion. Most studies show little to no drug interactions in terms of these, but in 2023 review suggests that glucosamine may increase anticoagulation effects of warfarin. I did want to bring that up because people who are on warfarin, which is a blood thinner, have to be really careful. There's a very small margin of safety, so I don't think that's a bad thing to keep in mind and bring up with your doctor if you're starting a supplement like this. Okay, and lastly, I'm going to be talking about collagen-based products. I think I have 3 products. So collagen is everywhere. It's ubiquitous in the body. You can see here in all of these different, got heart valves in the eye and in our muscles, in our skin, in our bones, and of course in our joints. It's everywhere, and there's different types. There's at least 28 types that we know, but by and large, when it comes to supplements of collagen for the joints, you're going to see type 2. That is the most prevalent type in our joints. You can see here's type 2. It's in our intervertebral discs as well. Type 1 is the most common collagen in our body altogether, and that's what you find in the skin. But type 2 is usually in the joints. So type 2 found in the joints and cartilage. The sources, when it comes to getting type 2, you can, in the case of our products here, it's from the chicken's sternum, the breastbone. The reason for that is it's very similar to our own cartilage. So that's the common source. And the purpose is resistance to tension, right? It's like that steel, it can bend, it can resist tension. So that's the main purpose in the joints. This type 5 and type 10 are way less common, but they are in this product, eggshell membrane, which is also a collagen product. It's a good option for people who are vegetarian because these ones are not vegetarian. And this also actually incidentally contains type 1, which, as I said, we usually find in the skin. If you ever crack open a hard-boiled egg and you take off the shell, and in the inside, you'll see there's this very thin stuff you can peel away, and it's so strong you can pull at it and kind of snap it. That is the eggshell membrane, and it's a trademark ingredient. It has a few, a bunch of small pilot studies. So another thing to note when you're buying collagen is it comes in different variations of its original structure. UC2 is unique in that it is what we call undenatured. The UC stands for undenatured. That means that the collagen is fairly intact. It's like a braid is what it looks like. It's fairly intact. And interestingly enough, we can't digest it in this form. So you might be thinking, well, how does it work if you can't digest it? And I'll show you in a moment. But if you add heat to this and it breaks apart, you get gelatin. Or if you fry an egg, you get the same idea as you undenature it, you untwist it. Then, now either by way of your own digestive tract can come and kind of chop this up into smaller parts. But typically, when you're buying something like BioCell or eggshell membrane, these are trademark ingredients that are purposely chopped up into what are called peptides. Peptides are not the smallest part of this very big collagen protein, but they're small little, they've got amino acids, that's the smallest part, but small little chains. And they're small enough in many cases that we can actually digest them intact without breaking them down further. and they're called hydrolyzed collagen. You'll see this term widely on supplements. It says here hydrolyzed type 2 on this bottle. That means they use water, hydro, to chop it up into these smaller peptides. It's water soluble, unlike gelatin. And most supplement studies are on this type of hydrolyzed collagen, but this one is not. Okay, so I think we're gonna start with the UC2, the undenatured. So up close, UC2 in this undenatured form has these little areas called epitopes. These are regions that allow this collagen to attach to this area in your digestive tract that's called Peyer's patches. Think of Peyer's patches as tonsils in your digestive tract. Your tonsils are an very active immune tissue. Peyer's patches are as well. They attach there, and the immune cells that are there go, "Ooh, wow, what's going on here?" Metaphorically speaking, they say, "Hey, this stuff seems pretty good. I don't think we need to worry about it. It's kosher, so to speak." They will go off to other areas of the body, like the joints, and somehow signal or communicate that collagen is okay, don't attack it. There are some studies on this like type of undenatured collagen that showed may be helpful for rheumatoid arthritis, although again, we can't make claims for that at all. But that is because it seems to, one of the signals it gives is anti-inflammatory. In rheumatoid arthritis, the body's attacking the joints. But even for ordinary osteoarthritis, it seems to have some helpful effects in encouraging the making of more of that cartilage and breaking down less. And that's what they show here on the UC2 on their website. First step, it binds to these Peyer's patches in the digestive tract. And then you have this activation of these T cells, part of the immune system. Those T cells travel to the joints, and you have this kind of signal or alarm to rebuild and repair the joint cartilage. And so they've done a number of studies on UC2. It's shown in these particular studies to help or to outdo in terms of staying active glucosamine and chondroitin. In this particular study, helps to get up to 10% or more range of motion in the knees. So that's how much you can sort of bend and stretch, range of motion, and helps support joint comfort. This is an interesting study that showed an so in some people, up to 17.6% increase in cartilage thickness in the knee. So there was a significant increase in the thickness, a significant reduction in WOMAC scores. That's just a score that's very commonly used to judge pain in the joints, actually created right here in Ontario. And 30% of those who were taking NSAIDs, like so non-steroidal inflammatory drugs, stopped taking their pain medication after 12 weeks of supplementation. And also, again, we can't make claims on this, but there is a committee that says that UC2 can be safe for pets, and there are all kinds of studies, which I haven't reviewed, but I'm just showing you here on dogs, cats, and even horses. One of the best things about UC2, and I have my brother-in-law on this, the one who I said has the sort of bow-legged joints. It's just one a day, which is fabulous. And it's able to put so much in there because you don't need a high dose in order just to provide a signal for that cartilage. So now we've got two. Now it's two different kinds. It's got its advanced and its regular. The advanced has still in one capsule. It's got the cartilage, the trademark cartilage. It also has this mineralized red algae, which provides some calcium and magnesium. It has a little of hyaluronic acid, which attracts 1,000 times its weight in water, if you remember. A little bit of boron and vitamin D. It has a whole 1,000 IU of vitamin D. So for some people, that's the entire dose they take. So it could replace a vitamin D supplement depending on how much you use. So I like that as a one a day. Now, eggshell membrane is also interesting. So eggshell membrane has its own, the unique biological matrix. It's not a mammal, but it still has this. So this is where the membrane of the eggshell membrane would be under here, under the shell. And it's a sulfur rich, and it contains collagen types 1, 5, and 10. It also naturally contains chondroitin sulfate. Again, that's like our airbag dissipating the impact, and hyaluronic acid. So it naturally contains all of those. And it helps relieve joint pain and stiffness, including when associated with osteoarthritis. It is a patented extract, and it has been shown in clinical trials to be effective in as little as 7 to 10 days. I think everything works better used longer, but this is just kind of the bare minimum of when you might notice some changes, but that is pretty quick. And here's a randomized controlled trial looking at the efficacy of eggshell membrane to improve joint functionality in knee osteoarthritis on 80-year-olds, 80, not 80-year-olds, 80 adults, average age 38, compared to placebo and 2 different doses of the eggshell membrane. I just used this one because it's the most recent one I could find, 2022. The results were the average weekly knee pain improved in the high dose group compared to the control. And that high dose is the dose that's on the patented eggshell membrane that we have. And lastly, BioCell collagen. So this is a hydrolyzed type 2. So we got BioCell, and the other one was UC. The other one was the one that's undenatured. This one is hydrolyzed. It's chopped up into little bits. BioCell contains the hydrolyzed collagen 2, chondroitin sulfate, and hyaluronic acid, little bits of that. I'm just showing you one of their trials. You can actually look on, usually for a trademark ingredient like BioCell, you can Google it, you can find the website, you can look at all kinds of information, but a randomized controlled trial in 80 subjects here showed that 2 grams a day of BioCell for 10 weeks significantly reduced joint pain as compared to placebo. No adverse events reported. And you can see here, the interesting thing about this particular BioCell, so if you're thinking, well, would I use BioCell or UC2 if you were to, compare the two? Well, BioCell actually also has studies showing it can be helpful for the skin. So 1 gram used for 12 weeks led to significant reduction in skin dryness and scaling and global line wrinkles. So if you are kind of interested in help with your joints and your skin, this may be the better option, but it is a 4 a day, 2 capsules twice a day for the joints. So that's something to take in consideration, depending on, it's a 1 capsule, easy, this one, but you get maybe a broader use. So just a bit of a comparison here. If you're going back to the video to see BioCell versus UC2, both good, it just depends. For skin, the studies use the equivalent of 2 capsules a day, and for joints, 4 capsules, but this is just a 1 a day. And that brings me to the end. So thank you so much for everybody that has joined this evening.